Hi, I'm Stephanie Feld, and I just want to take a minute to talk about EMDR intensives and how they can be helpful for people who are living with chronic illness or who have experienced medical trauma. And so these are some of my areas of specialty. I also have lived experience with both chronic illness and medical trauma, so it's very, very near and dear to my heart. And I also have worked with an EMDR therapist to get some relief and some peace from the symptoms that I experienced, and also help because we're never done re-entering the medical system. So if you live with chronic illness, you know, your relationship to your body has been affected. When our bodies don't do what we expect them to do, it's deeply painful, it's deeply confusing, upsetting, and especially if you're a woman or a person of color, a person who's neurodivergent, your experience with medical providers may very well have been traumatic in its own right. Maybe you weren't believed, maybe your symptoms or your experience of your symptoms weren't understood or were misdiagnosed, and that can really affect us mentally and emotionally in a deep place. And so part of EMDR is identifying those moments that have touched us deeply. To other people on the outside, it might not look like, you know, the most traumatic thing that's ever happened, but you have a sense that it touched you really, really deep down. We want to get relief and take those moments that have intense emotion or reaction and reduce the distress level around them. We also want to take the beliefs about ourselves and about the world that we get from living with illness or disabilities and take a look at them, because they can really make us think painful things about ourselves. Something's wrong with me. Nothing in my world can go okay. The world isn't a safe place. I don't belong, I'm a failure. There's all kinds of beliefs that come up that we're confronted with when you're dealing with health issues or medical trauma that can really, really affect our quality of life, our relationship with ourselves, with others, the world around us. So there's a ton of stuff to do there. And then how to go to the doctor or get a procedure or do just like a routine checkup, even calling to make a medical appointment without that trauma being re-triggered. Sometimes just thinking about calling the doctor, going to a regular appointment where you don't even, nothing literally painful is gonna happen, can just set you off so deeply into a spiral. And this just undue suffering. So really we just wanna help reduce the suffering. If you want to work with someone who understands what it's like to live with a chronic illness, to feel unheard, unseen, or really, really triggered and activated when you're interfacing with the medical community, I get it. I've been there before, and I'd love to talk to you about what an EMDR intensive could be like in your own healing journey. So just reach out. We'll set up a free consult call and talk a little bit more. Take good care.